So a bunion, I see a lot. It's an enlargement of the joint at the base of the big toe. And the bunion forms progressively over time from excessive mechanics, excessive pronation in the foot. Also, bunions, they're not necessarily inherited, but you can inherit a foot type from your family that's more prone to bunion formation. Patients, this may not be symptomatic in the beginning, it may just be an abnormal deviation of the joint that's not yet painful. As it progresses, patients may find it's hard to find shoe gear to accommodate the bunion. It starts to cause rubbing against their shoes. As the bunion progresses, the joint becomes painful, it can become swollen, and they can have limited motion in the joint. And as it begins to deviate towards the second toe, it can cause malalignment of the second digit, where it starts to contract up and can even lead to overlapping of that second toe over the big toe. For treatment, there's a couple different options. There's conservative options, including accommodative shoe gear to accommodate the bunion, supportive shoe gear with more shock absorption, more motion control to control the excessive pronation, help to take pressure off of that big toe joint. There is padding. You can wear a pad over the bunion to serve as a buffer between the bunion and your shoe to prevent rubbing. You can wear a pad between your big toe and your second toe, which may temporarily reduce some of the pain. There are orthotics, which, if you can catch bunions early on, help to control that pronation and can help to unlock the big toe joint and halt the progression of the bunion from getting worse. So surgeries for bunions, really there's a variety of surgeries depending upon the patient's activity level, their symptoms, and how severe the bunion is. So your doctor will take an x-ray to look at the quality of the joint, to look at the bone structure, to measure the angles, to the degree of how much splaying has occurred, to really guide them as to what procedure would be selected. There's procedures at the head of the first metatarsal, which tend to have a shorter recovery of about 6 weeks. There's procedures for more severe bunions where correction has to be maintained at the base, involving a joint type fusion, where those procedures, because of they're unable to withstand excessive weight bearing early on, these have a longer recovery period of anywhere from 8 to 10 weeks. However, there is changes in the types of hardware and fixation. Some of the hardware now can go on the outside of the foot, which allows for earlier weight bearing and walking, which makes it much easier for patients to comply with their post-operative instructions, so that way they can have better outcomes. So really that would be selected with the patient based on the x-ray findings and what their anticipation is of what they would like their outcome to be and their activity level. But patients also need to understand that even surgically, you still need to control the excessive mechanics and the forces that cause that bunion to occur in order to maintain that surgical correction for many years to come. And that involves continued modification of shoe gear, use of orthotics, especially in their high function shoes, to control the excessive pronation, flattening of the arch, splaying of the forefoot.